Hi, I'm Sue-Ann Han, founder of Elemental Health. I'm one of the 13 certified EMDR specialists in Singapore. I specialize in EMDR, which is a treatment for trauma-related depression, any form of anxieties, or any form of mental health challenges. EMDR was developed in the 1980s by Dr. Francine Shapiro. She first discovered it when she was walking through the woods, and coincidentally, as she was walking through the woods, she realized that some of her disturbing memories got desensitized, and that's because she was moving her eyes left to right. She realized that disturbing memories was desensitized. It lost its negative resonance, and she was very excited about this, and she ran back into her office, into the research lab, and told everybody to test this. And when she told everybody to bring up the disturbing memories and move their eyes left to right, something very interesting happened, and that led to clinical trials of EMDR. So just as a metaphor, how it worked in the brain is EMDR mimics the REM sleep, which is when the eyes move left to right. That is the time when the brain is trying to process something or a traumatic experience that just happened. But many times, traumatic experience may be stored in our brain, and it cannot be processed during the REM sleep. Therefore, it's stored as frozen memory in the episodic memory. So how EMDR works is, EMDR actually is able to retrieve those memories, traumatic memories, from the episodic memory. It's metaphorically speaking, it's like, retrieving it from the episodic memory and putting it into a working memory folder. And then during processing, the information and the memories is being updated. And when it becomes adapted, it's stored into an adapted folder. That's when the memory loses its negative resonance. So EMDR is a structured therapy that has 8 phases. So in phase 1 is when history taking happens, where the client do most of the talking. And phase 2 is when we prepare the client and stabilize the client, is where we call it the calm, safe state for the client to be in. And in phase 3, we will put out a clinical landscape of all the memories and what they would like to start from. Sometimes they may not be able to identify some of the adverse life events or memories of the past, but we'll be able to help them to do that. And that's when we put it into a clinical landscape to show the client. In phase 4, we will start to reprocess and reconsolidate the particular memory that have been chosen. And during that phase, the client will be asked to bring up the image, the picture, the negative belief, the emotions, and the body sensations, as well as to describe the level of distress. And as they are holding all of this together, the bilateral eye movements will start, like this. And in between sessions, in between the bilateral eye movements, the client will be asked for feedback. There's no right or wrong, it's just whatever the brain wants to bring up, the brain will bring it up. And then the process continues until we complete in phase 8, whereby at that stage, the client would no longer have any negative resonance of the memory, and any form of depression or anxieties or stress that they feel about that memory will also be adapted. So not only there will be a shift in state, there will be a shift in characteristic traits also. So the client not only just feel calmer, but the client may feel confident and resourceful, or safe and brave. This process can take anything from 4 sessions to 12 sessions. So usually when I first see a client, I will encourage them to come regularly for 2 months, once a week. Usually the client will start to see improvements after the 4th session, and then we'll review it, and then we'll spread out the sessions. Each session is about 60 minutes. An extended session will be 1.5 hours. So EMDR was first developed and tested on people with post-traumatic stress disorder, people that have experienced trauma. But then later on, EMDR has been widened to include people and population group that have anything related to depression, anxieties, stress, or personality issues. This is because EMDR helps with any memories that is still affecting you or your body. It can be anything related to trauma, or it can be anything related to childhood, or grief, or something that happened in your life that is very shocking or unexpected that overwhelms your coping systems. So EMDR is for a very wide population group. It can be used for anyone that is having anxieties, depression, stress, grief. So as long as they are comfortable to see a therapist, I would encourage to seek certified EMDR therapists if you are interested in this. There are many different kinds of treatment modalities in psychology. What's most important is to find a trusted clinician that you have a good therapeutic alliance with. Healing is possible.